sadly, outbreaks linked to drinking water. New data revealing the source of the most serious infections. Here to explain, Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Dr. Wilds, thanks for joining us.
Okay.
Well, so the CDC analyzed public health reports for a 5-year period, found 214 outbreaks associated with drinking water in 28 states. Now, even one outbreak from drinking water seems like a lot to me. Does this sound like a lot to you?
So, Erica, really great question, but let's just put things in perspective. We have 214 outbreaks that we have seen. Now, when you think about the world's population, there's 1.7 billion individuals that have been impacted by contaminated water. Now, let's think about that. That's approximately a quarter of the world's population having really poor drinking water. So 214 cases, really a drop in the bucket, not something that we would need to be too alarmed about. The U.S. has one of the safest drinking water systems.
Well, that's good to hear. Let's break down the numbers a little more, though. According to the CDC, more than 2,100 people got sick. That included nearly 90 who died and 563 who were hospitalized. So what are you learning about any specific causes?
So the three most common pathogens that we see that have been causing waterborne illness are norovirus, which is one that we've heard about a lot. There's also Shigella and Campylobacter. Now, a lot of these symptoms are short-lived, and the symptoms, you might ask, what are they? It's nausea, vomiting, and diarrhea. Most people do well without any hospitalization or even death. The ones that we worry about most, those that have underlying medical problems, those are the ones at greatest risk for doing poorly.
Okay, well, this might bring to mind local cases of Legionnaire's disease, because we've reported on them, including one earlier this year that health officials linked to a hot tub at a resort in New Hampshire. Obviously, that's not drinking water, not supposed to drink the hot tub water, but how do things like that happen?
Well, for Legionnaire's disease, what we have found that is one of the waterborne illnesses that we see, but you can also contract it from inhaling the droplets or the mist in the air. The key thing to point out is that it's not transmitted person to person. Patients that do end up with Legionnaire's usually have flu-like illnesses. Some are very ill, require hospitalization. But in general, most people do well, except the elderly and those who are immunocompromised. And as always, if you have any concerns about this, please contact your healthcare provider.
All right, Dr. Simone Wilds, thanks so much. Have a great weekend.
You too. Thanks.